Leah. I graduated from the ethics program in 2018, so I think I'm the most recent graduate here. And I'm currently in medical school at Stony Brook on Long Island. So I'm just going to talk a little bit about how I got to know about the ethics program and what it's kind of done for me both personally and professionally so far. Um, so when I was at Fordham, my undergraduate program, I had always known that I wanted to do medicine. I'd wanted to go to medical school, but I started out as a bio major, but I was kind of learning along the way, and we had these, required core classes, and I took one in anthropology, and I started thinking about the way that social determinants of health interact with medical care and healthcare outcomes, and I decided to declare a second major in anthropology. But I think that what I was looking for was to kind of understand these ethical issues on a deeper level. And then I figured that I had to take a lot of classes like forensics and anthropology that weren't quite what I was looking to learn, but was still like a great and exciting experience all through. And then I heard about the ethics program from a theology professor that I had at Fordham, and he had been part of the program. He told me about Dr. Fisher, and I scheduled a meeting to talk with her. So I ended up being a research assistant as well as doing the accelerated ethics program. And it was such a great experience because for me, it really helped build my research portfolio. I didn't really know much about research when I started working for Dr. Fisher. I'd kind of done research projects here and there, but I hadn't really worked on anything to publication. And that was an opportunity that the ethics program gave me and the ethics center gave me. So I worked on a lot of projects in psychology, and I actually then found what has now turned into be my medical interest, because we were studying informed consent and patient physician interactions in men who have sex with men. And in learning all of that stuff, I started realizing, oh, I'm interested in sexual health. I'm interested in LGBTQ populations. And so not only did that kind of set me up with research for my medical school applications, but actually helped me personally to realize what in medicine I wanted to do and what kind of effect that I wanted to have and what patient populations I wanted to work with. So after working with Dr. Fisher and working on a couple of projects, I was also taking classes, of course. And for me, it was an opportunity to not just hone in on only medical stuff, but to learn a bunch of ethics in different aspects as well. And so I took a course in urban planning, I took some in social work, I still took bioethics and medical ethics because those were interesting to me, but I also took some classes in law. And it's been great because I've realized that now working in the medical field, things like urban planning taught me a lot about homelessness and how that affects people's healthcare. Courses like social work have shown me the social work aspect of dealing with my patients, case managers, how that actually works. And so it also helps me to be more mindful in my practice and thinking about how to take care of patients and the intricate steps that actually go from just administering care on a patient physician level to healthcare being translated to patient well-being. So it's been really helpful in just even conceptualizing my medical career and approaching, I guess, my framework of what I want to be as a physician. And as kind of working alongside with the ethics program, I started realizing my passion for advocacy as well, because you can't really learn ethics without kind of getting angry and wanting to fix things. So I also kind of learned more about myself in that aspect and wanted to translate that a bit more. So getting to medical school and knowing all of these things that I knew about social determinants of health and ethical issues and how they work within medicine, it was like so frustrating to see that a lot of my classmates like had no idea that these things were happening, and we're just kind of treating medicine as this, biological thing. And so that kind of set a flame under me, and I was like, okay, I have to do something about this. I started talking to school administration, working in ethics into our curriculum. So we actually were able to get a couple of courses established, which has been really great. Seeing the first years now, kind of learning all of this stuff that I hoped and like that my classmates would learn at the time has been great. And someone actually just reached out to me and was talking to me about, they just learned about disproportionate healthcare and like the Tuskegee studies, and they had just kind of learned all of this stuff newly. And they were like, this is so insane. The professor told me to reach out to you. And it was just really exciting for me to kind of hear people excited and interested in ethics as well, because that wasn't an option that even my peers and now people coming after me would have had if I hadn't gone through this ethics program and I hadn't kind of had this awakening for myself. And just career-wise, I'm actually about to start applying for residency. So I'm coming to the end, starting my 4th year currently, and I just decided to do urology and specialize in sex med. So I'm actually really excited, and it's a lot of the stuff that I worked with Dr. Fisher on, and I just learned about when I worked in the ethics center, and now that's kind of setting the chart or like charting the course for my larger career. So that's really exciting for me too. So I'm happy to answer any questions about medical school, the application process, and it's a horrible process if anyone is interested in talking about that. How the ethics program was actually the biggest thing that I talked about in all of my interviews for medical school, and everyone was most interested in how did I get here? This wasn't like a typical thing that they were saying most applicants have. And as well as just kind of the experiences that I've had in medical school and how ethics has shaped both my personal and professional trajectories.